In 2025, it's very clear that the world is off track on NCDs. Only 19 countries or territories are actually on track to SDG target 3.4, that target of reducing premature mortality by 2030. And in the meantime, 43 million people are dying every year from non-communicable diseases. Essentially, we're living in a world where ill health is becoming the norm rather than the exception. We have 1 billion people living with obesity, 1.3 billion people living with hypertension, and 1 billion people living with mental health, just to name a few. We know what works in NCDs. We know how to prevent, we know how to treat. And yet these solutions are not being implemented at a sufficient rate in countries, and particularly in low and middle income countries. We haven't seen significant and sustainable financing into these issues, which would really bend the curve on NCDs over the next 5, 10, 15 years. We know that preventing and treating NCDs is a good and a sound investment. Every dollar spent on NCDs, governments are getting a $7 return. To mobilise adequate and sustainable financing for NCDs, firstly we need better data, and that's data on NCD financing at the country level as well as at the global level. Secondly, it's clear that the sources of financing need to come from different places. I think the main focus needs to be on domestic resource mobilisation. We know that given the current landscape that we're in. But in NCDs we have a really important tool here. We have health taxes, which are a triple win for reducing consumption of these unhealthy products and improving health, reducing healthcare costs, and also generating income for governments. And with health taxes, we're talking about taxing alcohol, tobacco, sugar-sweetened beverages. A recent Bloomberg task force on fiscal policy showed that if all countries increased excise taxes by 50%, they would save 50 million premature deaths by 2050 and generate an additional revenue of $3.7 trillion over 5 years. And more than half of this would be generated in low and middle income countries. So this is a real win-win for health and the economy. The period between the World Health Assembly and the UN General Assembly, these next 4 months, are absolutely critical. We need to see advocacy, activism in every single country around the world over the next 4 months, and we need to see as much unity and cohesion with our messaging as advocates as possible. Obviously, if we're all singing from the same song sheet, pushing the same priorities, we're going to see stronger outcomes from this high-level meeting.